Hello, everybody. My name is Benjamin Day,
And I am Jillian Mason.
and this is Medicare for All, the podcast for everybody who needs healthcare. All right. Well, the United States, as you know, we are exceptional. We are unique among
Special.
industrialized nations. Very, very
Mhm.
special. And lucky for us, we have a special thing which we can do, which is accumulate medical debt. Now, that might not sound like news if you live here, but actually, most industrialized and even many developing nations have national healthcare programs that basically guarantee care to all residents, aka Medicare for All, which makes medical debt more or less impossible. But we are the richest country in the world. So that means we have the freedom to get insurance through the free market and freedom to go into debt when it doesn't cover the care that we need. So,
USA, USA, USA.
yes, I feel like freedom is, the theme of the presidential elections this year. So we know what our freedoms are.
Yep.
So according to the Kaiser Family Foundation, although over 90% of Americans do have some form of health insurance, collectively we owe at least $220 billion in medical debts. That's billion with a B, as in Ben.
Approximately 100 billion of those is mine. I know.
Oh,
sure.
yes. You personally accumulated. Yeah.
Yeah.
And all right. So to break that down a little bit from a person to person basis, about 14 million people owe more than $1,000 in medical debt, and 3 million more owe more than $10,000 in medical debt. I'm remembering all this research that like almost no Americans have like $500 worth of savings. So now you can see why we can't afford to pay $1,000, $10,000 debts. So, when the debt is cast more widely to those who have put their medical bills on credit cards, of course, that means, medical debt technically is when you owe the hospital money, but you haven't paid them anything. But if you pay them with a credit card and then it ends up in your credit card debt, guess what? 41% of all adults in the United States have healthcare debt, either owed directly to a hospital or a collections agency or to our own credit card company. So you could say that the debt is as American as apple pie, Jillian, I think.
Oh, yes.
41%. It's something we all share in common.
And also it's delicious and has a flaky crust.
And it's what you talk about over family gatherings. So, and obviously, as with almost everything in the healthcare system, there is racial disparities and inequities in how this is distributed. Medical debt disproportionately impacts Black and Latinx households. And much of that debt is due to the really shitty insurance policies that we get now that have high deductibles and all kinds of other cost sharing, like copays and coinsurance and on and on and on. So this is why 41% of us have debt. Most of those people have health insurance. It's just not good enough to actually provide medical security or financial security. So that is one of the pillars of why Medicare for All is a low to no cost sharing at the point of care. We really insist on that when we're fighting for Medicare for All system. And we know that even people with insurance will delay or skip care if there is a cost sharing burden. Cost sharing is a term that sucks, and it sounds too nice for what it actually is doing. You're not really sharing a cost. You're getting smacked in the face and hit and facing the cost.
Cost hitting in the face.
Yes, cost smackdown, cost violence. I don't know.
I like that. Yeah.
Yeah, but once we do get care, so this is like the two sides of the coin. There's avoiding care that we know we can't afford, and then there's just going ahead and getting the care anyway and ending up with medical debt on the other side. So these are kind of the two halves of how shitty the healthcare system is in the US. So we're going to dive into this topic of medical debt, who has the debt, who profits off the debt, and of course, what can we do about it? So, Jillian, question for you to kick this all off. how would you describe like what causes all this medical debt? Is it I can't even ask with this a straight face. Is it overuse? Are people out there recklessly
Oh,
getting colonoscopies whenever they're bored? I know that's what
no.
I do in my free time.
The fact that I haven't been able to get a colonoscopy in 4 years makes this a very sensitive subject for
I'm like,
me. Um, but yeah, no, it's right. It's true. We're going out there, we're using all this medical care. Obviously, people in other countries use a lot of medical care too, because it takes a lot to keep this body going. But, they, but they don't have all that medical debt. And so like the obvious reason is that we have tremendously high prices, right? So we have these high prices they're charged by hospitals. Big pharma wants their cut, insurance companies want their cut. And so, most industrialized nations, right, have some means of controlling prices. But in the USA, the healthcare industry sets the prices more or less however the fuck they want. And as a result, this is according to polling back in 2022, over a 5-year period, more than half of US adults report going into debt because of medical bills. It's crazy. And it's preventing us from doing all the things that we're supposed to be doing in order to adult properly, like saving for retirement, paying for college, buying a home. And so that same poll from 2022, it found that like 1 in 7 people reported being denied care due to unpaid bills, right? And two-thirds of those who were polled reported like putting off necessary care. And to me, that's like the saddest part, when people are like, I don't even want to bother to engage with the medical system because I know I'm not going to be able to afford it.
Yeah. So as you were going through the list of things that when you have medical debt, you have to also put off, like retirement savings, paying for college, like that. I think most other countries actually do a better job of publicly supporting those things too. So it's like a really compounding of like all the shitty American systems, like weighing down on the everyday people like us. So, it's like college isn't free here.
Yeah. College isn't free. You don't have a pension plan. You don't, have buying a home isn't something that's subsidized for, whatever. It's like, it is the great American clusterfuck. And all of this, by the way, is it's despite the fact that the Affordable Care Act actually expanded insurance coverage to like more Americans than ever before, as they told us. But that just means that insurance companies are increasingly shifting their costs onto patients. You get higher deductibles and more claim denials. And apparently about 61% of insured Americans have medical debt from the previous 5 years. And like, it's like insurance, you're supposed to get insurance, and that's supposed, I guess, I think part of what troubles me so much about this is like, here are people who are doing quote unquote everything right according to capitalism, right? They pay their insurance premiums. They got a job that offered them insurance in the first place. And here they are still fucked.
Yeah, and I would like to throw into the list. I mean, I know we blamed pharmaceutical companies for the high prices, hospitals, we blamed insurance companies. I'd like to throw in employers into the mix, because I think one of the big reasons that our insurance coverage is getting shittier and shittier, and the reason that even people with insurance are ending up saddled with medical debt, is because employers are shifting all their costs onto their workers. It's like, how much can you do right when you don't even get to choose your own insurance plan? It's like your boss basically chooses it for you, more or less.
Yes.
So yeah, screw you employers also.
Yeah. Ben can say that now that he's no longer my employer. But yeah, screw those employers. All right, Ben. So now, like you said, Great American Clusterfuck, right, involves a lot of different kinds of debt, right? Like people get into debt for like everything in this country. Like we got the mortgages, the credit cards, the student loans, the business loans, the tremendous gambling losses, weddings, funerals, all of that, right? Ben insisted that weddings should be on the list because he is currently in debt for his own wedding. So like, all right, there are lots of different kinds of debt in this country. So what makes medical debt special? Like, why is that something we need to pay particular attention to?
Well, I mean, in some ways, I think we should pay attention to all the forms of debt. I think we were talking a little bit before the show about, I remember there's a bunch of research showing that the majority of people who have their home foreclosed, it's actually due to medical debt. So all your debts in all other areas of your life can impact, your medical costs can impact your ability to have secure housing, and vice versa. If you get stuck with credit card loans from something else, or your mortgage payments are too high and your income doesn't keep up with it, that can also affect your ability to access healthcare. Because if you don't have money, it doesn't matter how it's all been taken from you. You just don't have money for basic sort of essentials in life. But
like a home budget is kind of a zero-sum game. You have a certain amount of money and a certain amount of pots that demand you to put money in them. And
exactly. But there are definitely some unique things about medical debt, I think. So, we know that healthcare systems are denying care to patients who have unpaid bills. So, hospitals, clinics, physicians' offices will, if you have an outstanding debt with them, they can refuse treatment sometimes. And they will know whether you have medical debt with them, but they might not know whether you have, unpaid mortgage payment or something like that. So that makes it a uniquely bad for accessing the care that you need in the future. And we also know that, of course, people put off care so that they won't incur more debt. And those barriers make us sicker, and they disproportionately impact people with higher rates of chronic conditions who just need more care. So the Commonwealth Fund did a report. They found that 54% of people with employer coverage skipped or delayed care. Those who did skip or delay care reported getting sicker. So we know that it's harmful to be avoiding care like this. And 61% of people in individual market plans and 63% of people with Medicare reported the same thing. So if you're not in a traditional workplace-based insurance plan, it's actually worse for you. Your health is likely to take more of a hit from skipping or delaying care. And this is my least favorite of all of the research that we're going to talk about in this episode. There was a study from earlier this year, 2024, in the Journal of the American Medical Association that found that medical debt is associated with higher mortality and premature death. How, you ask? It turns out in every possible way. They basically looked at communities that have high levels of medical debt, and they looked at mortality rates there, and they looked at also, like, how many days of the year do you report being sick or injured or sort of in poor health? And, obviously controlling for everything else, controlling for income, controlling for education, all that stuff. And they found that basically communities that have high levels of medical debt die sooner of every single possible cause: cancer, heart disease, and suicide. And that those communities have vastly higher levels of people being sick or in poor health more days over the course of the year. So we know that it's having medical debt is very, very, very dangerous for you.
Yeah. And also, I mean, this is like, we've mentioned a couple of times, I think, and we'll talk about it more, right? But this idea that people can then be denied medical care because they have this debt, right? So like, even if you are, keep going back to the doctor. I had this crazy experience, Ben. I went to have an MRI, and I was logging. They had me like log in, right? They give you a tablet now and have you like, play video games or whatever, or answer their questions. I don't know. So I'm signing in for my appointment, and they literally wouldn't let me sign in until they had a credit card number for me. And so, if I had just shown up there thinking that I was going to be able to, get something and then bill my insurance or whatever, I would have been screwed. And that MRI happened to reveal the fact that I have a hernia, which is not entirely serious right now, but could be a potentially fatal condition, right? So like, it's like a total, I can't afford the medical care. That's preventative, right? And then eventually that would have just led to me getting sicker and sicker and sicker and sicker and sicker. And I thought someone should do something about this.
Yeah. And not everyone even has a credit card to log into the system. I mean,
all this shit.
Totally
all this shit. Yes.
Yeah. And when I saw the note about how suicide rates also go up in communities that have high levels of medical debt, it reminded me of a story when very early on when I started at Healthcare Now. There was a series of hearings throughout New York State. They were doing sort of public hearings for the Medicare for All bill in New York. And there was a retired detective, so he works for the police, who testified. And he said that a big part of his job was investigating non-homicide deaths, so suicides essentially. And he said quite a few times people committed suicide because they had medical debt, and they didn't want it to affect their family. So, for example, there was a guy who his family owned a farm, and I think especially he needed long-term care and couldn't afford long-term care. And in order to qualify for like Medicaid, you have to spend down all of your assets, which would mean selling not just his farm, but the whole family's farm. And it would have impacted him and the family generations below him. So he just killed himself as a way to spare his family from his like medical needs getting worse and worse over time. It was just like the most horrifying thing. Yeah.
Wow.
Oh,
wow.
Yeah. On that uplifting story.
Way to go, Ben. Way to bring things up. Yeah.
I know. But as you can imagine, that story like really, really stuck with me. That testimony did. And it did clearly, this was not the only time that this detective like ran into a situation like that where someone had killed themselves because of medical debt, and it really weighed on him heavily. And I can understand why. So let's say you've got medical debt. What happens, Jillian, like what's the process if you can't pay that medical debt? Like what happens to you next? We could probably both speak to this from personal experience, but let's speak more broadly.
Well, I think that this is important to talk about, right? Because like the grossest part about debt is how they collect the debt. And I'm sure anyone who's listening now who has been in any kind of debt has had to deal with the embarrassing calls at work, the embarrassing calls at home. Maybe they look up your parents' phone number in New Jersey and call them at some point. Hi, Mom and Dad in New Jersey. So I mean, basically like it's important to remember medical collection is a for-profit business, right? So we have these nonprofit hospitals who are like, pretending to be like public-minded, right? And they sell their debts to a for-profit medical debt collection agency, right? And then some health systems actually are able to operate as their own for-profit debt collection arm. And so they set the prices for the services as high as they want. And on the other end, they're making money off of debt collection. This is like, oh my God. Honestly, this is very similar to how the mob works.
Right.
Just throwing that out there.
Right. I think that, it's like the tobacco industry investing in, funeral homes or something.
Exactly. So that's rough. Anyway, we've seen a lot of different examples of this, like at Brigham Women's Hospital, which is, a beautiful hospital in Boston that provides lots of great medical care. But Dr. Luke Messick, right, who was a doctor there, he, in a July hearing of the Senate Health, Labor, and Pensions Committee, he actually testified that he learned that his and many other hospitals, as well as collection agencies, report sick and vulnerable patients to credit bureaus, garnish wages, seize bank accounts, and seek warrants for their arrest, which is the ultimate.
Wow.
I mean, that's like some Dickensian shit, right? Like debtor's prison. And again, right, like these hospital systems are, restricting patients from getting needed follow-up treatment until their debt is paid.
Right. Yeah.
Mm-hmm.
Yeah. And that actually reminds me of a, I told you this story. I won't tell people why I was in small claims court. I was on the suing end, not the being sued end. But I was in small claims court on behalf of a small nonprofit organization that was basically trying to get money back that had been taken from it by a unsavory individual. Let's put it that way. But I had to sit through small claims
diplomatic.
court. Yes, I did my best. The story is actually much funnier and worse than all that. But so I had to sit through a couple of sessions of small claims court. One is just like kind of filing the claim, seeing if the people show up who are accused, and then one is for sentencing. And when I was at the sentencing one, it was all credit card companies basically. It was like one or two real people like me, and then it was everything else was credit card companies, basically doing all of these things that you just listed, trying to get wage garnishments imposed on people, trying to seize their assets, the right to seize their assets. You can ask for the ability to get an arrest warrant, and then you have to like pay someone to arrest them, which is like another weird for-profit scam industry. But yeah, this is what happens. Once they collect debt and you don't pay it, then they offload it to a really unsavory for-profit company that doesn't mind doing evil shit like this. So
yeah, that's right. The Kaiser.
And sometimes it's not for very much money. So yeah.
It's true. It's just for fun. Yeah. So that speaks to this thing of the Kaiser Health News. They did this investigation in 2022, and they like examined billing and financial aid at like 528 hospitals across the country. And they found that more than 2/3 of them will actually sue patients or garnish wages. About 2/3 report patients to credit rating agencies, which of course negatively affects their credit scores and hurts their ability to get housing or jobs or get married or get a tax return, anything. 1/4 of hospitals sell patients' debts to debt collectors, which is a fun way for hospitals to make money. And about 1/5 of them deny care to people with outstanding debt. Again, one of the grosser ones, right? Like you're supposed to, at least if you're a hospital, you're supposed to pretend, right, that you care more about the person than the money. Right. I've always felt that way. Like they should pretend that, right? But no, they're not even pretending anymore.
Right. Yeah. And this is, I mean, I think a lot of people, some people do have good experiences with their providers, with the doctors they work with and the nurses who care for them. And you don't want to think that those people are so evil that they'll do these types of things. But it's actually not them. It's not the providers. This is when we talk about massive administrative bloat in the United States, like tons and tons of growing ranks of administrators. This is kind of what they're doing, right? they're like, let's garnish wages. Let's send them to let's report them to the credit rating. All of this takes people and manpower. And ironically, the rest of us have to then pay for all that evil work.
Yeah, that's fun to think about, that you're actually paying for someone to collect your debts. Yeah, that's rough. Yeah. Rough. Oh, can I mention something here actually? Because I feel like, so Ben, have you heard this story before? When I first went into medical debt and was having problems with it, I had a lot of people, including a lot of lawyers, who came up to me and said, listen, just don't pay your medical bills. Have you gotten that advice before? Yeah. And the reason that they...
Yeah.
I mean, it's pretty common, right? For people to just be like, don't pay your medical bills or pay your medical bills last.
Yeah. Or the other one I hear is to negotiate with the hospital to try and like talk down what you owe them or something.
Yeah.
Not everyone can do that. So
Exactly. I think the rationale for a lot of people who say that you shouldn't pay your medical bills or that you should pay them last is because medical debt doesn't always go on your credit rating, right? But there are some situations in which it does, and you just want to pay attention to that, right? So unpaid medical debt that's sent to collections can be reported to your credit bureau after 1 year, right? So if you have unpaid medical debt for more than 1 year, that will go on your credit rating. And it can remain on your credit report for 7 years. And there was a rule that went into effect actually in April of 2023 that medical debt can only impact your credit rating if it's over $500. There's some new rules that would actually be put into effect that could make that could make that even better or whatever. But just I mean, I think probably even on this show we've said before, like, pay your medical debts to bills last, but do keep in mind that after a year they can put that onto your credit rating, which is something that I didn't know and makes me all the more depressed.
Shit.
Yeah, pretty fucked up. So given the fucked upness of this situation, I ask you, Ben, how do we fix this shit?
Well, we have one answer to all questions such as this on the Medicare for All podcast. The answer obviously is to win a Medicare for All system. When you take the profit out of healthcare, when you have a mental health plan that controls prices for care, impose any cost sharing on you, then you don't have medical debt, and that entire category of human problem doesn't exist in most countries that have universal healthcare systems. But I know that this is not a terribly satisfying answer for folks who might want to look for, like, how can we win something else, some other form of relief, as we're working towards winning Medicare for All. So I think we're going to talk about a range of different things, from lower to still quite hard to win levels. So you can, one thing is that specifically when we're talking about nonprofit hospitals, they are responsible for providing what's known as charity care. It's kind of a condition for them not having to pay taxes, essentially. So they're supposed to provide care and help patients who they determine if they're eligible for free costs or reduced costs or Medicaid. But one problem is that charity care standards are, like, really, really vague. So again, Kaiser Family Foundation report found that charity costs represented 1.4 or less of operating expenses at half of hospitals in 2020. So that means they're barely doing any. And another barrier to access is that hospitals, make applying for this kind of assistance really complicated. A lot of people don't know that it's a possibility for them to get charity care. And it's obviously, if you're a patient who's in a healthcare crisis, you're not going to have the capacity to, like, navigate all that bureaucracy. So one solution would be for the IRS to kind of use its existing authority to allow hospitals to verify patient income in real time, so they can immediately access financial assistance or a Medicaid. But hospitals don't do that right now, is the long and short of it. So.
Yeah, absolutely. So that's kind of that's sort of a more individualized situation, right? Where, like, if you as a individual person, right, like, happen to be in a situation where you're eligible for charity care, you could get it more easily, right? But of course, we love, as the socialist communists we are, we love a collective solution. So one other way of kind of approaching this, right, is actually collectively buying and forgiving medical debt. So I mean, we've all paid someone's medical debt because we've all contributed to a friend's GoFundMe. And I mean, GoFundMe basically, and all those crowdfunding platforms, they basically survive off of solicitations for medical expenses. Basically, what we can do is we can put that on a kind of we can do some crowdfunding on a larger scale. And so there's a great organization. You should totally look them up. I'm sure the link will be in the notes. It's called Undo Medical Debt. Get it? Undo. They are also formerly known as RIP medical debt. But they basically they came up with this easy way for Americans to buy up and forgive other people's medical debt for pennies on the dollar, and without actually lining the pockets of the GoFundMe executives, whoever they are. So any individual can buy up medical debt for pennies on the dollar and go to sleep at night knowing that they help to ease the burden on a fellow American. And it's because we do these things, because the undue medical debt brings people together to do this, that we're able to do it. So they kind of, that's sort of, again, it's been going on for 10 years now, and it's been a really kind of exciting development. And a lot of like cities and counties have actually tried to kind of take that idea to a new level. And so St. Paul, Minnesota, and Wayne County, Michigan, have actually used federal ARPA dollars to buy up the medical debt of some of their residents, which I think is super duper cool. St. Paul, Minnesota has a population of just over 300,000, and they erased $100 million in medical debt for 43,000 residents. Like, that's insane. That's wild. And when that debt gets erased, right, like what happens? Lower income families get, they have more money for rent. They have groceries, other things, right, that are so education, other things that are so important to lift people out of poverty. So that's some kind of the buying and selling of medical debt is a really, really shitty industry, but some people have found a way to kind of benefit from that and use it to forgive that. Yeah.
Yeah, I feel like the John Oliver show also did like a buying medical debt thing on one of their episodes when they were looking at medical debt. And, the sad thing that allows this to work, and again, it doesn't address the systemic causes of debt, and it's kind of like running in place to keep up with ongoing issuance of debt over the years. But the collections agencies who buy the medical debt, they also pay very, very little. So, if they're buying your $1,000 hospital bill, they might only be paid, $10 or $15 from the hospital for it. And that's because for most people, they're not going to be able to collect that debt, no matter how much assholes they are, no matter how many harassing phone calls they give you and, threatening letters. They usually don't get paid for the very simple reason that most people can't afford to pay it, which is the fucking reason they didn't pay the hospital in the first place. So that's why medical debt gets sold for so little. Exactly. Yeah. So that's why medical debt costs so little, and charities can actually buy up huge amounts of medical debt without paying very much, because you're basically paying what the collections agencies would be paying. So
yeah, absolutely.
All right. And we could talk about also another thing to pay attention to is the Medical Debt Cancellation Act of 2024. This is pending legislation that needs support. So in May, Representative Ro Khanna of California and Rashida Tlaib of Michigan, as well as some of our favorite senators, Bernie Sanders and Jeff Merkley of Oregon, introduced legislation that would eliminate $220 billion in debt, wipe it from credit reports, and limit the accrual of future debt. So that bill creates a grant program within the Department of Health and Human Services that exists to cancel medical debt, prioritizing vulnerable populations and debt owed to safety net hospitals, who particularly, get a lot of unpaid medical bills. So.
Absolutely. Again, that is the Medical Debt Cancellation Act of 2024, and you can call your reps and senators and ask them to support that bill right now. That's something you can do right now to help to get medical debt canceled. Another kind of thing that's coming up that's slightly more wonky is a rule change. And rule changes are kind of weird because they're not actually like laws that are voted on or whatever. They're handled within the committees that make rules. So the Consumer Financial Protection Bureau is doing some rulemaking to remove medical debt from credit bureaus altogether. And so it's a proposed rule change by the Biden administration, and hopefully it will prevent medical debt from appearing on credit reports if it ends up becoming an official rule.
Yeah, that would be awesome. And it's easier to win rule changes than it is to win legislation. So that's another one to lobby for. All right.
That's
So I
because
think the
there's no
last
Joe
thing
Manchin standing in the way of rules, you know?
yes, there's only a Joe Biden currently in the way of rules, and hopefully no one worse than that. So I think what we're going to wrap up chatting about is we're going to talk a little bit about some state efforts. And then we'll wrap with does anyone in this presidential election care about medical debt? All right. So looking at the state level first, about 20 states do have financial assistance standards. So I mean that's okay. That's not great, but 8 states have laws that are limiting or prohibiting the interest that can be charged on medical debt. That's something. And then only 3 states have limits on hospital or debt collectors' ability to sue their patients for debt. Illinois actually prohibits lawsuits against uninsured patients who have demonstrated an inability to pay. 11 states prohibit or set some kind of limits on foreclosures for medical debt. Both California and New Mexico prevent liens and foreclosures for the low-income population. We had to figure out what liens means exactly. It basically means they're taking your shit from you. A lien on your property means that they're just taking that shit from you. You're taking your car, or taking your house, or something like that. So anyway, that liens are bad, foreclosures is bad. And so in addition to that, California, New York, New Mexico legislations, New York and Maryland fully prohibit any liens and foreclosures on medical debt for anyone. So that's something that you should bring to a state near you if you don't have it already. So 21 states have wage garnishment protections that are higher than the kind of federal government standards that exist about how much of your wage can be garnished. The federal standards say that your wages can't be garnished can't be more than 25% of your disposable earnings. This sentence, it's so convoluted. You can see why it's going to be so hard to implement in practice, but 25% of the disposable earnings or the amount by which the worker's disposable earnings are greater than 30 times the minimum wage. Forget I said that entire sentence, but they limit garnishments on your wages. California actually prohibits all wage garnishments for low-income people, and New York fully prohibits wage garnishments to recover medical debt from anybody. So New York kind of leading the way here, which is nice. And Jillian, anything else that stands out to you from state level stuff?
Yes. Okay. So I do really like this one because it involves a carrot and a stick. No, it's actually more carrot. But basically, in July, they announced this new North Carolina plan, right? And it would give hospitals additional Medicaid dollars if they forgive the debt of 2 million residents. And CMS actually approved the plan. So it's something that could actually go through. So that would be pretty cool. I do like the fact that they're enticing the hospitals with something that they're always bitching and complaining about, which is that they don't get enough Medicaid dollars. So they're like, take your Medicaid dollars, but also forgive some debt, you felonious assholes. And then what else is there? There's also something good from Minnesota. It's not a surprise actually that the idea for this episode came from our researcher / show notes writer from Minnesota, where this issue is super duper hot and folks are doing cool things. But in 2024, Minnesota actually passed a Debt Fairness Act, which was actually pushed by Keith Ellison, the Attorney General. And he, of course, is a Medicare for All champ, who, is great. And so basically this Debt Fairness Act that they passed would ban providers from withholding care due to unpaid debt, would eliminate the automatic transfer of medical debt to a patient's spouse, which is fun. It'll establish protections from unethical medical debt collection, which is sweet. Require providers to publish their debt collection practices, which is good to know in advance. And then finally, it helps to create a new process to help people to dispute coding and billing errors, which is, a big part of medical debt is just, when people are unable to actually contest their bills, they end up just basically taking whatever the insurance company or the hospital says for, at their word. So those are some fun things, I think, really cool. We of course love these big legislative solutions to this issue. And like Ben said, right, until we get Medicare for all, we're still going to be in some kind of medical debt, but there are lots of different kind of steps that we can take to get it forgiven. And so those are some plans. Those plans, by the way, were mostly spearheaded by Democrats. And I believe the relief of medical debt has been supported by the Harris-Walz campaign, or just name checked at least. So I think at this point, you're left wondering, surely Donald Trump and J.D. Vance, they have a plan, right? So what is their plan? It's a joke. They don't actually have a plan. So literally, if you Google their names plus medical debt, literally nothing comes up. And we have the screenshot to prove that. We have the receipts. Right. Yeah. So lots of stuff.
And how many thousands of pages are there in Project 2025? And they just didn't get around to medical debt as an entire category of human suffering.
Didn't feel relevant. More important to talk about drag shows in high school bathrooms. Or
that's right. Only 40 to 50% of us were affected, so not that many.
But how many of us have been affected by drag shows in high school bathrooms or libraries? I think that's what they're worried about, right?
Maybe even higher numbers.
Yeah. Maybe even so. So this shit is all pretty shameful, Ben. I mean, relieving medical debt isn't a solution, right? But it's obviously the right thing to do. We've got people who are in immediate stress and hardship, and we want folks to be able to focus on their health. Why does this sound so radical? So obviously Medicare for all is the number one solution that we're pitching here, because, with a patchwork of limited protections and relief on top of a system that allows unfettered profiteering by the healthcare industry, medical debt's going to continue to be an issue until we actually talk about the price of care. So until then, we will keep you posted on mutual aid efforts that help people survive our American healthcare hellscape. And if you have a story, by the way, if you're listening out there and you're like, oh, I can tell you about medical debt, or if you have a positive story about the way your community, your church, your faith congregation, your school is coming together to actually support people who need healthcare, please share it with us, because we could all use some goddamn good news these days. And you can email us at info@healthcare-now.org. Ben, how would you like to thank the people for us?
Yeah, well, first of all, I liked this topic, or I liked all the information that Jerry pulled together on this topic, because so many of the healthcare issues that we talk about, the fucked up things with the healthcare system, you literally can't do anything short of a national law. But clearly there are, there's stopgap measures, but there are stopgap measures that can be one at kind of any level, like voluntary charity measure, city, states, counties, and it is happening all over the country. So I think there's ways that we can kind of stem the tide in the meantime while we're winning more systemic reforms. But I want to close by thanking the podcast team, especially for this episode. Our podcast manager is Angelique Davis. Our usual show notes writer, Jerry Katz, was pulling double on this episode and was also the researcher who came up with the idea for the episode and wrote out all the research notes for us. Thank you, Jerry. And our audio editor was Craig Stanton. So do not forget to like this episode, subscribe to the Medicare for All podcast on your favorite podcast platform. And this show is a project of the Healthcare Now Education Fund. So if you want to support our work, including the podcast, you can donate at our website, healthcare-now.org.
Excellent. And as always, we want you all to stay safe and stay dangerous out there.